Well, the tough part is behind you now, and it's time to go home. And you should have received a packet that includes prescriptions. And in the next few minutes, I'd like to tell you about how that all works. It's really not complicated, so I don't want you to worry. I've also provided for you a medication log, a table to help you keep track of your medications. So I think you'll find overall this is a pretty straightforward and simple process. We will be contacting you in a couple of days just to make sure everything is going okay, but please don't hesitate to call if you have any questions or need something clarified. So to go over your medications individually, and these are all in the written brochure and the after-visit summary that the nurses will give you, the mainstay of your recovery is based on 4 medications, principally 2. One is an anti-inflammatory and the other is a narcotic pain reliever. The anti-inflammatory is naproxen, which is the same stuff as in Aleve, just at a prescription strength. The narcotic pain reliever is an opiate-based medicine. It's typically Vicodin or Percocet. Vicodin is hydrocodone, Percocet is oxycodone, and it's really based on your past experience and your preference as to what might work better or cause fewer side effects. The non-steroidal anti-inflammatory is something that you'll need to take around the clock for 5 days or more. The pain pills are to be used as needed. There are 2 other medications. One is Phenergan, which is a nausea pill. It's to complement the scopolamine patch, which hopefully is still behind your ear right now. That's something you'll take off tomorrow. And then the other medication is a stool softener. It is a senna-based compound, and it's 2 pills twice a day, and you'll be taking that medicine until you're having regular bowel movements. Please don't stop at the first sign of a bowel movement. You really want to make sure you're achieving regularity, and at that point you can discontinue it. And certainly sooner if it seems like your bowel movements are becoming loose and you're just very sensitive to it, so you can cut back or just discontinue it entirely if you think that it's working a little too well. The main thing though is not to get constipated, because your appetite is off, your abdomen is distended and crampy and uncomfortable, and it just really it will make you feel very poorly. So let's go over the medication log. I happen to have a copy here, and hopefully you can read it. You can see it's based on the time of day and the day of the week. Although your prescriptions may say take every 6 hours as needed or something like that, I think you'll find it's easier to keep on this timetable, which is breakfast, lunch, dinner, bedtime, and that's to put a little something in your stomach and also keep you from having to pay close attention to the clock. So you'll see there's 5 days. I've included 2 extra days if necessary, but usually people are off the narcotic by 2 or 3 days because they've really learned to tightly regulate their pain medication needs. And the naproxen, I want you to continue for 5, even if you're feeling well, because it's doing work behind the scenes, and that's really important. Breakfast, lunch, dinner, bedtime is the regimen here, and you can see that there are slots sort of to remind you at the beginning. Take your naproxen. Ask yourself, what's my pain score on a scale of 1 to 10, with 10 being the most severe. This will help you understand 1 or 2, maybe I take a half a pill, 5 or 6, maybe I'm taking 2 pills. Record the number of pills, and then if you can't quite make it to lunch, or you can't make it all the way to dinner, that's okay. Just record the number of extra pain pills that you needed during that time, and that'll again help you sort of figure out what the pain scale really means in terms of your narcotic pain reliever needs. So once again, just to go over that, so we're talking breakfast, lunch, dinner, bedtime. You can take in between doses if as needed. This regimen keeps you from obtaining too much Tylenol. All of those narcotic pain relievers contain Tylenol as part of them, and what we're really trying to do is not we're not worried that you're going to get too much pain reliever. We want to make sure that you don't get too much Tylenol. So that's the reason for that regimen. So as I mentioned, the scopolamine patch comes off tomorrow unless it seems like you're having a little protracted nausea or discomfort. Sometimes it's related to the narcotic, and as soon as you're tapering off of that, you'll find that that dissipates as well. The main thing is not to get behind. With pain control, the more if the pain creeps up more than 3 or 4 on a scale of 1 to 10, you really want to get on top of it, because if you get behind and are playing catch up, sometimes you just don't catch up. So what we really want to do is make sure that you attack it aggressively, because you'll use less overall, you'll take medication for a shorter period of time, and overall your recovery just goes smoother in terms of constipation and the other side effects of those strong pain relievers. So I urge you to not be tough. Go ahead and take the medicines as needed. So as I mentioned, we'll be contacting you in a few days just to make sure that everything's on track. But of course, if you're having any problem at all or you have any concerns in the meantime, you have our contact information. Please don't hesitate to contact us. Thank you very much, and I wish you good luck, and we'll talk to you soon.